Hey there, I'm John Stupka here at Blue Med Center, and this is the wonderful Ferrina Sheth. Ferrina's a physician assistant here at Blue, and what are we doing today?
We are doing a vampire facial in which we drew your blood already. We spun it so that I can get the richest growth factors out of that, and that's what we did. We spun your blood for about 6 minutes total, redrew the PRP, which is the platelet-rich plasma, and which has the highest growth factors. We're going to use Rejuvapen to do a microneedling treatment and introducing the PRP on top of it so that as the microchannels are being created, the PRP is going deep to the dermis and causing all of those growth factors to act, and it's going to build collagen, elastin.
It made me look younger.
Yeah,
right? That's all I want to know.
We're going to do younger.
Really, the reason why I'm doing this today live on Facebook is I probably get 3, hits a day, questions about what's the vampire facelift, what's the vampire facial. We've been doing this here at Blue for, I think, almost 2 years. Dr. Charles Runnels, who invented the procedure, he actually came and trained our staff. We've gone down to his place in Fairhope where my parents live. And by the way, Mom, if you don't recognize me in 2 days, that's because I'm 10 years younger. So going on a family cruise in a couple of days, so I'll probably have a big...
Denise Kruger says hi.
Hey, how are you, Denise? Thanks for tuning in. So I figured, heck, I might as well go live, have a little bit of, time where, just the next couple hours, I don't have to be too much out there, but I do have an event tonight. So this is one of those procedures where you really don't have to worry about downtime. I mean, it's pretty much a no downtime procedure. You can get a little red, little pink. Probably wouldn't recommend to be a fancy event the same night, but a lot of guys that I know are asking me about this. We've had a lot of guys that come in here to Blue. You see a lot of men, don't you?
Julie Beatty says, looking good.
Hey, Julie. And so one of the things that we've started doing here at Blue with the vampire facials, we use, as you mentioned, the Rejuvapen. It's like aerating your lawn in the springtime. It makes little micro channels. We do several things with that. We're going to do my face with it, but we also do hair rejuvenation, and we're excited. In the beginning of the year, we're going to really be getting into hair rejuvenation. I probably have about 30%. Everybody's like, your hair always look good, but I know you know your own hair when it starts to thin out, and just by doing some of this and a little bit of the Monette products that we have, it's made a huge difference. So,
that looks great.
but yeah, let's get to it.
Okay.
Let's see what we got to do.
So a couple of things that I'm going to do today. Of course, we're going to do the microneedling. However, I'm also going to inject the PRP right under the eyes.
Whoa, does that hurt?
Not really, because I do add bicarbs into it. So
I'm a big boy, but still, I don't like needles.
It's the guys that always ask me about the needles and the pain. So, but you're going to be fine. And what it's going to do is, how we start to get the hollowness under the eyes. That's what really makes us look older than what we are, especially my patients who read a lot, attorneys, a lot of the physicians, other medical providers that come to me for that reason. So I will just kind of inject the PRP right under the eye. Again, it'll create that collagen, the elastin, and you'll start noticing that there's not a huge separation between the cheeks. You don't have that bad, okay? Your looks great. It's just going to make it look even better. So
she does work here, so she's got some extra brownie points for that.
Yes, bonus to
Yeah, I was curious. I mean, I'm just turned 46, so for me, it's a lot of times it's about preventative measures. There are some things, of course, having a business like this, you're a little privy to, some of the different procedures. But you'd be surprised. I don't get to take advantage of as much as I would like. So I said today, let's do this, Ferrina. Let's show people what this procedure is all about. It's really not a difficult procedure. I've already had, it's probably a little shiny, some numbing medication on. That's a topical cream that they put on. Took about 20 minutes to numb up my skin. So this is going to make the procedure very tolerable. That's what's nice because a lot of people always ask, did it hurt? And these procedures really are not uncomfortable at all. So we're about to find out.
Yeah. All right. So I'm going to do the under the eyes first. You can close your eyes if you like.
And our wonderful videographer today is Miss Brandy Morrow, who is here for you at Blue. She is a patient advocate as well as a licensed medical esthetician. So she's the one that can help you. If you come in, bring us your wish list. She will help create what we call our blueprint here. So similar to you renovating your house, if you're, in your 40s or 50s or even 30s, you may, have some little things that have been, concerning you, sun damage, those types of things.
I definitely recommend that people start doing it when they're younger, so you're not chasing the problem at that point. So you can start doing these little things. This is not invasive, so it's very easy to do and keep up with. I've had one treatment with it, and I'm loving my skin. Even my husband actually complimented me, saying that my skin is glowing, and I've had 2 kids, So, after having kids,
Right.
things change. So no, this is a great treatment. I recommend it for everyone. So I'm gonna do a quick injection. Of course, you're gonna feel the needle possibly going in, but other than that, you shouldn't feel anything else.
Okay, great.
You are quite numb.
And so this is a good thing for all around the eyes, because that's the one area that bugs me a little bit. I smile a lot, which is good, but sometimes those little lines can start to be a pain.
So the great thing about the PRP, I would say, is that you can't really overdo it because it has the growth factors that your body has. It will stop the receptors once it's reached this optimum growth.
I couldn't even feel that.
Really good.
Now, one thing that you probably shouldn't do too much is take too much ibuprofen, which I've been a little under the weather, so I've probably taken more than most. So if I am bleeding a little bit, that's probably what it's from.
No, and a little bleeding is no problem. You just put some pressure on it, it goes away.
I know they recommend, just trying to stay away from things for a couple days that thin your blood out, like ibuprofen.
Yeah.
Garlic, I know, is another one. Ginkgo, which I thought was interesting.
Yeah, exactly. Vitamin E, fish oil.
So you've been doing this for hair as well, huh?
Yeah, so again, PRP has been used in the OR for over 15 years to, regenerate any areas that have been surgically worked on. So with hair growth, it's fantastic. So here, we actually make sure that all your hormones are in line and also top that off with doing a microneedling treatment, injecting PRP into the area that needs that regeneration of the hair. You're doing fantastic, John.
Thank you. Seriously, I don't even feel this, what you're doing. So
very good. Very, very good.
I
That's
assume
what
there's a
happy.
needle going into my skin, but you have such a gentle touch, so
Thank
it's
you.
awesome.
Thank
Well, and I've had a lot of my friends that have come in to see Ferrina here at Blue, and they have been thoroughly impressed. You guys, Ferrina, I'll just tell you a little bit of her background. She has an integrative medicine background. She's been in GYN and all different types of specialties. So she really takes a whole person approach, looking at you when you come in and understanding not just what your aesthetic concerns are, but a lot of times there's underlying issues. Like she was just saying, with hair, it can be hormonal. So we do hormone testing here to check your levels if you're low on testosterone, or for women if their estrogen at different levels can be balanced, and getting back in balance with hormones can help everything feel better, right?
That's exactly right. That's why it's not just one thing. It's not a symptomatic approach, right? You want to have a systematic approach. So it's really, really important that when a patient comes in and says, "Oh, I just can't lose weight," well, of course you want to make sure that their age group. Why are they not losing weight? Are they trying everything? Of course, as we know, eating well, drinking water, making sure they're taking the correct supplements. Is there a GI inflammation issue or a leaky gut issue? And then you go to the hormones. So you do want to look at an overall report of course, we draw blood. We make sure that we look at all of the values so that we're not over or under delivering. But that is definitely my passion, and I want to make sure that, from head to toe, I can take care of a person.
Right. No, that's good. Well, I had to actually go on testosterone a few years back because mine was so low, which I didn't feel real symptomatic, but a lot of people don't realize. I always hear on TV, testosterone more for libido, but it really protects your heart.
Right.
They say that's
Exactly.
75%.
Awesome.
Oh, good. 75% of the receptor sites for testosterone are on your heart, so that's really important for women too.
Yeah, heart health. Hormones in general, right? If your thyroid is off, your heart is affected. If any of the other hormones are off, and estrogen, of course, the deficiency in women, you can see the change in their belly. You can see the change in their overall tone of the body. So that's why hormones in women, men is very, very important.
So with what you just did with injecting underneath the skin, that's going to help my, improve the tissue from the inside out?
Exactly. So it is going to prompt the body. So it kind of makes your body think, oh my God, there's an injury. Let me figure out what I'm going to do. Naturally, your body comes to the rescue, right, with the collagen and elastin production, so that if you have gotten hurt or there's the scar is the healing end product from PRP, the yellow stuff that we see when you've gotten hurt. That's
like
the dead.
me,
Yes,
gooey.
exactly.
Yeah.
That gooey, yucky stuff. That's actually, they were the very important growth factors that we needed. So that's what it's going to do. It's going to start to tell your body, hey, regenerate. So the fat loss is going to not be as evident.
Okay.
Yeah.
Yeah, it's always, I remember we had somebody that worked here said life's cruel joke was you lose fat where you want it the most, like your face, and you get it everywhere else like around the gut.
Agreed.
Because when you're trying to stay physically fit, you know, you really end up having a real hollowed out look sometimes.
Yeah. So I am gonna finish this procedure, and then Brandy's gonna take over and do your microneedling.
Okay, good.
Introduce the PRP with it, and that's going to be her base and the top. And then you'll go home with just maybe some PRP if it's left over, or some products that you need to make sure that you're.
Sure. And Brandy, if you want to show what we did here, this was actually the centrifuge, and where we spun my blood down. There's some of my red blood cells, all dark and icky looking, that we spun out, and then that leftover in that yellow syringe is what I can take home and apply.
Exactly, which is the PPP, right? Which is the platelet poor plasma. Even though it's great, I mean, we could use it in this procedure, but that's great for you to take home and apply within 6 hours.
Okay.
Okay. All right, I'm gonna say bye-bye.
So now I'm going to be selfieing it, I think, from here, right?
Yeah, that would be great.
Okay.
Yes, great, thank you.
Thank you, Ferrina.
Thank you, John.
Okay, so now we have Brandy here.
Walked around.
I'm gonna turn this around here. Okay, right here. All right, here I am, people. Bye, Ferrina. Thanks a lot.
Thank you, guys.
Bye, Ferrina.
See you when you're 10 years younger.
And your friend Niraj Sharma very look like bois.
Oh,
Like
nice.
bois.
Oh, nice. Oh,
Very
that's
good.
my mom. He said they look like my mom.
Oh, okay,
Aw.
that's
Well,
it.
tell him thank you. Bye, guys.
Have a great one.
Yeah.
She's going to do some holiday dinner with her family. She has 2 beautiful little kids. But if you guys get a chance, come see Ferrina here. She is fantastic. She works here right now just a few days a week, and she really can talk to you about anything that we offer here. We, of course, have other great injectors. Jennifer's been here for a long time, and then Trisha Burns has been with us for quite some time as well. 10 years to be exact. So you've got a good team here down at Blue. We're excited, though, to be launching some new things in the new year with the hair rejuvenation. We're doing a lot with this machine here that's called Thermi, and that is non-surgical skin tightening that it does. Wow, look at this. Okay, here we go. So she's going to be taking what we drew out of my arm and what we spun down, and we have in there, it's really concentrated platelet-rich plasma, which has little proteins in there called growth factors, and those in concentration will really help to make my skin look a little more youthful. Hopefully, can you make these pores a little smaller?
Absolutely.
One of the positive things with large pores is you're a little oily, which helps you probably not get as many wrinkles, but it really drives you crazy sometimes. So, and Denise just asked, does that hurt? No, I didn't even feel that injection that she did. I was a little nervous because I didn't know she was going to do injections when we were starting this, and she's like, no, let me flush some under your eyes. You can go ahead and start if you want. Okay. And so what she's doing is putting a little bit of this PRP on me, and Denise, it did not hurt at all, just so you know.
So what we do is we apply just a little bit of the PRP topically, and then we use the Rejuvapen to needle it into the skin.
Okay, great. And so this is kind of equating to what, aerating your lawn
Exactly.
in the springtime. So what we're doing is just little tiny, movements that she's pushing down on the skin lightly, because this thing vibrates at like 11,000 RPMs, which is really fast. It also has a really strong torque. This little device, for some of you that know me, I have another business where I consult with aesthetic practices, and we have over 100 practices that we help with these programs. So we've been offering this here at Blue for, I guess 5 years, and worked with this device for the last 4 years. And the injections, Denise was asking, what are the injections for? The injections were to help put some of that platelet-rich plasma underneath the skin, which will just improve the orbital area under the eye. A lot of people, they get to where they just look like a little tired under the eyes, a little hollowed out, and that's what it will improve. what you're doing is helping to improve the tissue underneath the eye, which is really exciting because the last couple of days I've been a little under the weather, so probably look a little more tired than usual. But this will just give you a little more refreshed look. But thanks for the question, Denise. And so what Brandy's doing is she's just going over in small little, what brand is this pen? Yeah, that's what I was just saying. This is the Rejuva pen. Rejuva pen's, I think, been on the market for about 5 years or so. And a little harder for me to see on this side. Let me move my hand. And so what we're doing here, she's just doing a little overlapping motion with the microneedling device. And Daniela is my sister-in-law, and oh, hey, how are you? This is from Mickey's sister-in-law in New York. How are you, Daniela? Thanks for the question. Yeah, so if this is something that you're interested in your city, since you're in New York, I would definitely try to find a place that has this brand called Rejuva Pen, because I know for a fact it's the most effective result-oriented one on the market today, which is good. And so Brandy, you guys, she does here quite a few procedures. She does our peels and facials. She does the Thermiva. What's the Thermiva? That's been a popular
Thermiva,
one.
oh, it's an amazing vaginal rejuvenation procedure that uses radio frequency. And
I love it.
to rejuvenate, after having babies, sometimes you have, a little bit weaker bladder, urinary incontinence. Sorry, I'm trying some issues with urinary incontinence. It helped me with that after having my daughter. Whenever
Right.
I'd go exercise, you have to stop sometimes. Now I don't have to stop.
Todd said, "I need that." You mean the vampire facial or the Thermiva, Todd? I don't know which one you're talking about here. We may be a little ahead of you. But yeah, so that's been extremely popular with women here for feminine wellness. That's really funny.
It also tightens and also helps with the mucosa production.
Yeah, so we also, that same device does tightening pretty much everywhere, right? A lot on the
It
neck.
does. We can use it to tighten anywhere on the body with the Thermi Tight, and then with the Thermi Smooth, it works very well in conjunction with this procedure. And for under the eyes, around the eyes, and around the mouth.
Very good. Matt just joined us. Todd said he needs both. Come on in, Todd. Brandy can meet with you. She can talk to you about anything.
That's right. So I can help you consult with anything from head to toe, practically.
Very good. And yeah, Brandy, I think you've tried a few things here over.
No, yes, that's my secret. My secret is I picked this career for a reason.
There's a few perks, that we have
That's
around here,
that's
right?
I love to help people, but it helps me look good too.
And then, so what are you doing with changing? Are you changing the depth there?
Yeah, so around the eyes, on the forehead, because there's not so much meat, we want to go a little bit lower depth. So.
And Daniel just asked me if I'm going to be sore after the procedure. Actually, I will not be sore after this procedure. This is something that right afterwards I will probably look red to you guys on the camera, but that will really go down within an hour or so. So, that's the nice thing with these procedures. There really is not that much downtime with them. Like I said, I probably wouldn't be going to a black tie event tonight, but you really just look a little weathered or sunburned, right?
Yes, and the PRP really helps the healing process. Really helps you heal quicker.
And what's good with this, like, she can focus on little lines. I sleep on the left side of my face, and there's a line right where she is that drives me crazy that that she can kind of go over a couple times. So if you've got acne scars, fine lines around the mouth, you can put a little focus on those, and those will dissipate. And then what kind of what should I do after this? What's the best thing? just kind of afterwards, just what kind of products you recommend?
Well, we have a post-care kit that we recommend that you get. It lasts for a couple weeks. And usually you do this in a series, and that kit has enough product in it to last you for after each treatment for about 4 days.
Okay, great. Robin said best treatment ever. Robin's an awesome medical esthetician that I know, guys, and so if you're in her area, look her up. She's doing the Rejuvapin at her couple places that she works. Hi, Robin.
Hi, Robin.
Yeah, so as you guys can tell, there's really not much to this. You get a little bit of, pinpoint bleeding, as you can see. That's actually a good thing. Everybody doesn't respond that way. What's that? This way? Okay, like here. No, she's good. Oh, and you can do, like she's doing, you can do under the neck area as well. Because we're stimulating some collagen, you can get some tightening. If you go online and look at some of the Rejuvapin before and after pictures, works really, really well. Daniel said he's very interested in doing this in 2017. Well, fantastic.
Come see me, Daniel. We'll get you taken care of.
Yeah, this is something that like we said, we do in a series. We always do, around the holidays, we always do some fun promotions and specials. We do have a series special where you buy 3 of these treatments, you get 1 free. So it's about a 25% savings, which is nice. And Robin, yep, you can go back to work, ladies, the very next day. And how about us guys, Robin? Don't forget about us.
And the great thing, ladies and gentlemen, actually, you can put on a mineral makeup afterwards. There's a great product called Oxygenetics that we partner with, and you can use that pretty much right away. And then any kind of mineral makeup you can do at least 24 hours after. And for men, there's Revisions has IntelliShade. A lot of my male...
Oh yeah, you did say men. She said,
yeah.
And I said men.
A lot of my male clientele use the IntelliShade just to, if there's any redness left after 24 hours, some people like to use that just to help combat that a little bit.
And, we get a lot of golfers and executives and CEOs, really all different walks. I think men, the misnomer has been this is such a vanity type of thing. I mean, for me, I want to, look as healthy as I feel. And, that's the nice thing with doing these little treatments and procedures. So what are you putting on now?
So now I had a little bit left over in the syringe, so I'm just kind of rubbing it into the skin. This is the
great.
The PRP.
So I'm just a little red and pink, right?
Mm-hmm. Not like that Kim Kardashian picture.
Right. Yeah, you guys, if you ever saw Kim Kardashian, she's actually the one that really made the vampire facial that Dr. Reynolds invented really popular. She posted her bloody face on Instagram, but the video made it look like she was like bloody murder. Of course, that was probably for a little bit of ratings. So, as you can see, there was no pain at all. That was a very simple procedure to do. I'm gonna sit up here now. So I'm a little red, and it'll be good. I'll post some pictures later so you can see what my face looks like. But as you can see, and I'm more sensitive skin than most people. So I would say that if you're sensitive skin, you may want to not plan a big event the night of the procedure. But other than that, that was easy procedure to do. But if you guys have any questions, Brandy, she's here. She can, our number here is 404-815-8880. Or you can look us up at BlueMedCenter.com. But we're right in Midtown, right on 10th Street, right across from Zocalo and right at by the Flying Biscuit here. So feel free to stop by anytime. Brandy's usually here during the week and can do a complimentary consultation for you. But thanks for tuning in to see this. I hope you learned a little something about the vampire facial, vampire facelift, PRP. And if you have any other questions, just hit me up, okay? Have a great holiday. Thanks again.
Bye.